Hi, I'm Laura Bonanno, and I'm representing the AANA Foundation Task Force for Poster Abstract Submission. I will be presenting an overview of abstracts submitted for case study or innovation projects. At the AANA Annual Congress during the Program Directors Luncheon in August 2023, there was much discussion about the abstract submission and review process. Dr. Jordan and AANA Foundation board members shared some of the challenges regarding the quality of the abstracts received, which included poor writing quality, the abstracts being incomplete, there being a lack of substantive data to support the findings, and that there was inconsistency among reviewers in scoring the abstracts. Dr. Jordan asked for volunteers to serve on a task force, and this task force charge was to revamp the abstract review process, including evaluate the current poster abstract process and identify gaps in the process, looking at the applications, the criteria for each category of abstract, and the criteria for reviewers. The task force was asked to create suggested changes to the abstract process and to create a new abstract process to include a new application, a new review process, and new or revised criteria for review, and also finally to create educational videos for applicants and reviewers. The revisions from the task force included narrowing the abstract categories down to 3 major categories. The first category being research, which includes both qualitative and quantitative. The second category is non-research, and that's evidence-based practice and quality improvement. And the third category, also non-research, is case study and innovation. And that's what I'm presenting to you today.
Here are the qualifying questions for case report or innovation projects. A case report describes an unusual, complicated, or novel case, including the symptoms, signs, diagnosis, treatment, and follow-up of an individual patient, and includes the relevant literature on the topic. So the qualifying question for a case report is, does your submission describe the case of an individual patient? If the answer is yes, then you will have the right category. If the answer is no, you should choose a different category. An innovation project describes a new invention of a product or process that demonstrates adherence to scholarly standards and practices with proof of concept backed by evidence from the literature, which includes pilot studies. So this does need to describe a new invention. The qualifying question here is, does your innovation project reflect an innovative product or process? If the answer is yes, then you have the correct category. If the answer is no, you would need to choose a different category.
This is the scoring rubric for non-research, case study, or innovation projects. It begins with an overall section. And here we're looking to see whether there is any critical flaw or weakness that would preclude the abstract from being accepted. Some examples would be that the abstract was inaccurate, was incomplete, or was only a literature review. Please note that a literature review only will not be accepted, and there's a definition provided here as well as in the guidelines. The overall section is not scored. It's a separate yes or no question. If the reviewer answers yes, we ask that they provide a comment, and the abstract would be rejected. The next section of the rubric is the title and introduction section. There is a character limit here of 1,050 characters, and this does include spaces. There are 4 criteria here. Each is scored as either yes, which is 1 point, or no, which is 0 points. We ask that if the reviewer selects no, that a comment is provided. The first criteria is, does the title reflect the project? The second is the focus of the case or innovation clearly described. Third is the relevant etiology, epidemiology presented if it's a case study, or is the problem and aim of the innovation described if it's an innovation project. And the fourth is, are unique features of the case or the innovation included?
The next section of the scoring rubric is the presentation. And here you can see there is a character count limit of 1,600 characters. Again, that includes spaces. And the criteria for this section includes, is the relevant patient history provided if it's a case study, or is the innovation clearly described if it's an innovation project? Are research ethics adequately addressed? Is the peri-anesthesia or analgesia course described if it's a case study, or is the innovation utilization described if it's an innovation project? And then finally, is data analysis and or an evaluation plan described? Please note that the scoring is the same for each different section. The next section in the scoring rubric is the discussion section. Again, please note there is a character limit of 1,750 characters, and again, that does include spaces. So the criteria for this section is a detailed description of the outcomes of the case or innovation provided. Are detailed and appropriate conclusions for the case study or innovation discussed? Is an evidence-based plan of care described in the case study, or does the literature support the innovation design and implementation if it's an innovation project? And then finally, are implications and recommendations for clinical practice and or the anesthesia profession discussed? And once again, the scoring is the same. This section of the rubric is the writing style and format section, and this is just what the reviewers will score. The first criteria is, are the guidelines followed? The second is correct APA format used. The third is correct grammar, punctuation, and sentence structure used. And then finally, is the abstract logical and well organized? And again, the scoring will be the same. Here are some overall tips. One, it's really important to follow the template to ensure that all required sections are addressed. The reviewers will be using the scoring rubrics, which evaluate each section of the abstract. So if the template is not followed and a specific criteria is missed, the reviewers may give a 0 for that criteria, which could affect the overall score of a really good project. Next, the character limits are hard stops. So if a certain section is over the character limit, you will not be able to submit the abstract, and an incomplete submission would result in the abstract being rejected. And it may be necessary to have a trusted person review your abstract just to make sure that all criteria are addressed. Some additional tips for case reports. It's important to make sure that the patient history is included, the peri-anesthesia course is discussed, there's information regarding your literature review with current recommendations, there are conclusions, why do you think the patient outcomes occurred, what current treatment recommendations would have produced a different outcome, and then finally implications for clinical care. It's important that you simply and clearly describe why your project matters, why is it important, and also that you clearly described what it is that you did for your project, whether it was a case study or an innovation project. And then finally, for the reviewers, you really want to review each abstract looking for the following. Is the case study or innovation well described? Is a detailed description of the outcomes of the case or innovation provided? Are detailed and appropriate conclusions for the case study or innovation discussed? Are implications for practice discussed? And then, is the abstract written in a clear and concise manner, and is the topic of the abstract a good fit for the meeting? On behalf of the AANA Foundation Task Force for Abstract Submissions, I want to thank you for your time and attention today, and we look forward to the submission of quality abstracts.